Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today we have a great panel of guests from the team at Clearsense. First off, we have Randy Fusco, he's chief technology officer. We have Craig Hall, chief data officer, and Charles Boise, he's chief innovation officer. Welcome, guys.
Good to be here.
Glad to be
Thank
here.
you.
Yeah, excited for this discussion. Clearsense obviously has done a ton of work with data. It has a significant footprint, as a data platform with many healthcare organizations. Randy, why don't you kick us off? What are some of the data related trends that you're seeing across the industry and with your clients?
Yeah, my pleasure, John. Thank you. It's no surprise overall that the healthcare industry is becoming more data driven. Growing recognition of the importance of data, really improving patient outcomes, reducing costs, focusing on delivering more personalized care. So with Clearsense, we recognize that and we want to drive the value of our platform focused on those types of use cases. When you look across the industry today, what you recognize are things around patient safety. That's always top of mind when you look at most healthcare organizations and payers. Serious focus around patient safety. And a lot of that starts with data and human behaviors around that data, how you manage it and support it in support of that. Another really big trend that we see is digital transformation. In my experience, John, that term has kind of been loosely manipulated in a lot of different ways, but at the end of the day, it's how can you leverage the technology investments, especially around data, in informing a lot of those personas around the people that are accessing healthcare organizations or wanting to talk to someone about their health plan and get details on better care, right? Preventative maintenance, better care, ultimately creating that bond and relationship between the healthcare system, the provider, and the patient. And we've been talking for years about putting the patient at the center of the universe of care. And I think we're slowly moving in that direction. I really do think that. And with the ability to leverage more with less, I think most organizations you talk to today, it's all about cost optimization. How can we do more with less? How can we leverage the technology that we've already invested in? And so we take all of that into consideration. But really, at the end of the day, we know that there's a growing recognition of importance there. And it's all about improving patient outcomes, making sure safety is top of mind, and leveraging technology to enable the business of healthcare. That's really our primary drivers there.
Yeah. I mean, Randy, we've covered this so much on this podcast, and I've said it many times before, the future of healthcare is built on the back of data, which is, I think, what you just described.
Yes.
Craig, I'd love to hear your thoughts, because, as Randy kind of wrapped up, I thought about it like every healthcare organization is doing something with data, right? Like they're doing some data, some analytics, right? They're doing something. I don't know of any organization that's not. So what would you recommend for healthcare organizations that maybe want to modernize or even transform what they're doing to data analytics to have a bigger impact?
Great question. And fundamentally, the challenges that our clients are facing are around the complexity of the data. All of the systems that they're needing to gather critical information out of, conform that information into meaningful insight across the enterprise. And so one of the major focuses of Clearsense and kind of our guiding principle is getting the data into a streamlined data-driven framework. And that is a recommendation for all of the challenges across both the payer and the provider space. And the way that we recommend accomplishing that is to really focus on what the business deliverables are, what their use cases are, and make sure that the technology that you're putting in and the frameworks that support that technology are built for rapid delivery. Rapid, when we're talking about getting data in all different sizes, formats, structures, getting that data conformed into the enterprise type of constructs and concepts around that, so that you can govern the data, so that you can manage it at at the business level. And that's where our main focus is when we talk about these frameworks and these fabrics that we're putting in. I would say that is our number one recommendation. If you take that into consideration as you're building out these strategies, the insight into the data with all the powerful tools that are out there is so much easier. We need to work within our enterprises on getting rid of trying to jump to the insights before we get all of our data understood, all of our data managed. That's probably our biggest recommendation is spend the time up front, make it a business-driven framework, and the insight into this data from whatever or part of the organization you're in, from the researchers to the actuaries, the statisticians, and all the way through just the executive dashboards and clinical analytics will come to fruition.
Yeah, I love that. Let's organize the data. And for me, it's about trust. Once it's organized, then the data is trusted and you can put it into action. Charles, what would you add to this, as far as what would you recommend for healthcare organizations to go to the next level? And maybe let's talk about some advanced tools. I think you've seen this evolution. We've had you on the program before talking about, data analytics, but how about also, advanced tools such as AI, machine learning? How do you apply that to these efforts?
Yeah, in bringing what Randy and Greg have stated, going forward, that these advanced tools, machine learning, artificial intelligence, are absolutely data driven. And the remarkable thing about attacking, data science from a platform perspective is that we have the ability to not just only bring in the data that's traditionally thought of from clinical practice, but also everything that puts out a signal within the healthcare organization. Pumps, physiological monitors, anesthesia machines, all of that. And then think about data from the environment. We call it exposome data. So temperature, humidity, pollen count, even data from social media. And then more importantly, data from the home, whether it be wearables, whether it actually be, monitoring systems in the home, but bringing that all into a, single environment that we can then, start practicing, AI and ML. And it's really important because really, honestly, 20% of our health, if you will, is in front of the, providers and whatnot. The rest of it, is out in the environment. So it's really important that you have the ability to work on that. And then kind of talking about, AI and machine learning, we've actually been doing that in healthcare. I work in an environment where we were building models and whatnot back in the late 80s, early 90s. We called it math back then. It's
That's
still
what AI is.
It still is now. So
good point.
I'm glad there's some traction there, but it's interesting. There's some things that we got to be cautious of. We've got to, artificial intelligence sounds great, but really when you're talking about healthcare, it's really an intelligent assist, right? I'm flipping the letters a little bit because we're not having machines tell us what to do. For crying out loud, we many of us spent, 8 to 12 years from an academic perspective, and now this machine is going to tell us what to do. I don't think so. But if this machine can help us make really sound decisions, bring up things that we might have missed, absolutely. So from a healthcare perspective, I see these advanced tools, assisting folks in clinical, assisting folks in operations, and more importantly, some of the discoveries that we are making because we have all these, data sources and whatnot. And if you're fortunate enough to have a healthcare organization that's been around a while and has all of those legacy systems that have been, converted properly, now you have, 20, 30, 40 years in which you can build out models as opposed to, a couple of years. So yes, it's really exciting. I know everybody went nuts yesterday when Chat GPT stated that it wants to be human. I don't know the full analysis of that exchange, but let's see. Because, honestly, folks that prescribe do not want to be prescribed to. But if we can assist them with these tools, that's fantastic. But again, it's all data driven. You have to have that data accessible to build out, the proper models and whatnot.
Yeah, I love that switch from artificial intelligence to intelligent assistance. That's a good little twist there. And Craig, I mean, his final point is the good one, right? Like we need the data to be trusted, to be in a format that we can use it to be able to use these AI tools to assist us, or machine learning, or whatever it might be. Are there some best practices that you've seen, working with all the clients at Clearsense to kind of ensure that you're successful in implementing a data platform? Because I mean, how many people have built up enterprise data warehouses and then never seen anything from it? So are there some best practices you've seen as you roll out and you implement a data platform?
Yeah, absolutely. And it's a great question. And once again, this is it's a business driven world that we're living in here. And so part of the concepts that we incorporate into our technology, into our frameworks, are all around getting the data in as quickly as possible, and spending the time to manage that data from the time that you bring it into your environments. And what we're really preaching, and what we're really achieving successes over by following that methodology, is not having Excel wars going all over within the company, and creating more and more siloed business solutions. And so it all starts with being very efficient at how you're attacking all of your data challenges from all of these different sources. And then the second is we have to manage the data. And so when we're building out our frameworks, what we're doing, and what we're seeing, where we're seeing the challenges with our clients, that we're helping them overcome, is quickly get the data. We like to call it, get your data conformed. You have to conform the data before you manage it, simplifying the experience using technology as the enabler. And so once you get your data into these common conformed environments, now is where the fun begins. And that's where you start understanding your data as it lines up against all the other data within your organization. That's we call them the aha moments of, whoa, I thought this was my trusted source. Well, now that we can have an enterprise perspective of our source data, now we can start really making improvements to our data through reference data, through all the other different type of functions of starting to have this trusted data committees, data governance, if you will. That is just core to the success of our clients. Is trying to do too much too early causes too many problems. So bring your data in, get your data lined up, then you can manage your data. It's a simple three-step process. Simple, I guess maybe it's not quite so simple, but it's easier. It's easier. Let's put it that way.
It's easier to describe. I think, it's interesting you bring up Excel, right? I mean, I think Excel is the enemy to this, because it does what you describe, which is gets you to that pay dirt quickly. But the problem is it doesn't scale. It's not a best practice. You can't use it across multiple organizations, et cetera. So it's interesting to hear that. Randy, what would you add for healthcare organizations, as far as, things you've learned working with your clients, or the opportunities that they have to make use of data?
Yeah, thanks, John. I have this conversation often, like, Randy, we have limited or precious budget and resources. Where do we invest to make sure we can maximize our value? And at Clearsense, we certainly want to meet our customers where they are in their data enablement journey. Some are just getting started and just need to know prescriptive guidance. What's the ABC 1, 2, 3, the first step? And others are well advanced. Charles spoke about AI, ML, and some of the technology. And my recommendation is, when you look at those investments, don't just put technology in for the sake of technology to kind of keep up with the Joneses, if you will, John. What business problem are you trying to solve? Are you trying to improve clinical or operational outcomes? Are you trying to shorten the time and distance it takes, for example, to get prior authorization for a critical procedure that a patient needs? How can the technology enable it and accelerate it in a way that becomes 1 + 1 is 3? And so we keep that as kind of top of mind. But I can tell you, the journey for most healthcare organizations will continue, regardless of what stage they're in. there's some key areas in Clearsense's opinion, and what we're already have developed or are incorporating into our product roadmap for technology enablement. One that I would call out most definitely is interoperability. I see that being an absolute key, almost table stakes at this point. If you're a data platform company in healthcare, if you don't have a robust interoperability capability to support a lot of the like the components Craig was talking about, getting the data in, getting it managed, getting it curated, the transaction behind that, whether you're wanting to do a fire or a smart on fire transaction downstream at the point of care, so you can enable interventions on behalf of the physician and the patient, or if you just simply want to dynamically spin up self-service or self-configured dashboards or analytics reports, or even interoperability through further applications and connecting the dots. I see that as a big game changer, breaking down the silos, improving the exchange of information between different systems. It's been around for a long time, but I think more of the EMR, EHRs, and certainly CMS is kind of saying, hey, this is not a nice to have, this is a must have if we're truly going to put the patient at the center. A couple of other ones that'll continue, I think, cybersecurity. Again, I kind of alluded to that in the opening. They have to invest more robust cybersecurity measures to protect patient data. Clearsense itself is high trust certified, certainly support any and all PHI, PII type transactions from beginning to end, and we're very proud of that. But I would say, John, overall, healthcare organizations will continue their data journey and those investments. Hopefully, we Clearsense can be part of those journeys. But when you focus around the interoperability, patient engagement, we talked a little bit about that, like digital transformation, that's a byproduct of that, cybersecurity, and I would even throw telemedicine in there. How does data really enable telemedicine? Well, it's the core of everything you're going to do. You have to access those systems in order to support those transactions and capture all that data and sustain that as part of a longitudinal patient record of care, right? So at the end of the day, John, I think if there was a soundbite that I would leave for organizations looking for investing in a data platform is focus on the data transparency to insights. If you can qualify that data through your subject matter experts, regardless of what tool or technology, if you can get transparency into your data, your success rate for making good, informed, and insightful decisions is going to be much higher to support the business.
Wow. I mean, you think about the evolution here, right? I don't think any enterprise data warehouse was thinking about interoperability. It was pour everything in and then run your reports, right? Like,
it was basically a bolt-on, right?
Yeah. I mean, as a data platform, though, it makes sense. Hey, I might want to push this data somewhere else, or I may want to access it from some other system. That's a different mindset, I think.
It is. Yeah. Thank you. It's all about the business rules and the intelligence around the data and how that gets transacted to drive that use case or value. So, I mean, yeah, you nailed it.
Yeah, well, let's talk about that value, Charles. You're a longtime clinician, so it's always fun to talk analytics when we talk the business side, right? That almost seems obvious, right? Like, yeah, of course we want to know how the business is doing, but how do you see analytics helping on the patient outcome side of things?
Sure, and we'll talk it in the perspective of a couple of examples.
Okay.
So I'm in a critical care trauma environment, and I have a really nice set of algorithms, assisting me, throughout the day. And I get a notification that, hey, look, your patient in the last 30 minutes, 60 minutes, heart rate's changed by X, blood pressure's dropped. Here's some labs that have come in. Hey, 8,000 patients that presented like this with your patient's diagnosis demographics are likely entering, let's say, a sepsis pathway. That's really good information for me, because then I can then make a really good cognitive decision. So I see these products really working from a clinical perspective to, one, hey, something's going on here, and then two, this is likely what the outcome may be, but you're leaving it up to me to make that decision, and you're also leaving up to me as what is the the proper course treatment. Also, along the same lines, one of the toughest diseases to deal with is heart failure, especially advanced heart failure. So, even from a cardiologist perspective or a general practitioner perspective, what's the staging of that patient and what are they likely to need, right here and right now. So I see this again, being very, assistive, as we move forward. And to make these types of exercises and products successful, there's a couple things you need to do. You need to involve the clinicians. You need to involve everybody that's going to interact from a very, very early perspective. So they understand the volume of data. They understand what are the various data elements that we're looking at. Yes, some of them are the clinical things that we normally think of, but there's a lot of data external to that that does have some impact on that algorithm. Then you take them through the model build, you take them through the various ensembles of those models, and then you take them through the output. And you're going to have false negatives and false positives. False positives we can deal with clinically. False negatives are kind of tough to deal with because that's a miss. So everybody's involved in how we're going to shape that going forward, and then more importantly, having frequent reviews and getting into the mindset that what works, let's say in Jacksonville, Florida, is going to need to be tweaked to work in Los Angeles. These various products and whatnot are not interchangeable. They actually need to be tweaked, and they need to be continually tweaked. So I see good promise for this as we move forward, but again, very cautiously involving the stakeholders and taking it from an assistive perspective. And I hate that word prescriptive analytics. We need to get rid of that because again, those that prescribe do not want to be prescribed to. But we just continue along these themes, and I think we'll put ourselves in a really good place.
Yeah, that's a good approach.
As just adding on, you can tell we're passionate about being a business driven. It's no longer a world of build it and they will come. And you have to understand all the diverse needs of the business, and that starts from understanding there's real-time data needs now within the insight. And as Charles' examples just are spot on, you have to design and build and have these frameworks very dynamic and adjustable to ebb and flow. They need to scale up, they need to scale down, whatever's hitting the business next with their next crisis or their next challenge. We have to be ready to adapt in the back end technology. So as you can tell, we're very passionate around the business, the business driving the technology. So that is a key focus from all three of us.
Yeah, I can tell you, John, as a clinician myself, Charles and I often smile with a knowing nod, like, "Oh, that's not going to work." And what's the old saying, Charles? The fastest way to not get adoption from a clinician is to change the workflow without them being part of the new workflow. I've seen it too many times. So what you just described is just spot on and so true. So we make a conscious effort, John, to ensure that the stakeholders, including the clinicians and the care providers, are all part of the redesign, if you will, if necessary, at whatever part of that journey it is. So it's so important.
Yeah, I mean, I don't know anyone that likes to be told what to do, right? They like to be involved in the
especially
process.
Doctors. Yeah.
Absolutely. Well, Randy, as we wrap up, but it's interesting. Craig talked about, you have a wide variety of customers that are at different points in the journey, but are there some key areas that you see in healthcare organizations that they should be focusing on for 2023 as part of their data journey? Anything beyond what we've talked about?
I would say there's a couple that come to mind, John. Immediately as you were asking the question, I jumped right back to the interoperability, but we covered that a little bit. I would say being focused on the use cases. Many times what we find is, especially the larger healthcare organizations that have multiples of terabytes of data just historically, the idea that they want to and think that they need to leverage all of that in some capacity when we dig into that, and we have readiness assessment checks, for the different types of data enablement services with our platform, as we get in and start asking the pointed questions, it quickly becomes obvious, like, we don't really need 15 years of historical data to put a patient summary together for a transaction in the past, 18 months. So I think it's more of the customers thinking through what really are the pain points. Don't even think about the technology necessarily, but what are those pain points? What are the workflows that are in process already that could be an opportunity for modernization, if you will, right? What legacy applications are we using and paying money for, where if we were to do X, we could achieve Y? So it's really more focusing on the output and the value and the use cases, and then enabling that through the technology the best we can.
Interesting. Yeah, I was talking to a lady one time and she said, we don't need big data, we need skinny data that actually
really
provides meaningful results. I thought that was kind of a nice way to, a nice marketing effort, similar to what you just described.
Yeah, for sure. Yeah, and it is very enlightening, I think, for the customers too. When we come in and, collectively, we have a lot of experience, and within Clearsense, a lot of healthcare data SMEs. And so they really appreciate having a conversation that is at their level and understanding, and being able to kind of dial it up or dial it down based on where they're at in their journey. And so that's exciting for us. We get passionate about that. At the end of the day, we're all kind of problem solvers, and that drives us. But we definitely don't lead with technology as a hammer and everything's a nail. That doesn't work.
Yeah, absolutely. Well, Randy, Charles, Craig, I appreciate you taking the time and sharing with some insights and perspectives on analytics and everything that's happening. As I said near the beginning, data, the future of healthcare is built on data, and harnessing it is going to determine, I think, which organizations are successful or not. So thank you so much for helping us with those insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks so much, guys.
Thank you, John. Pleasure.
Thanks, Jim. Thank you.
And that's a wrap.